Thank you, Mr. Speaker. Mr. Speaker, I rise today to speak about the failures taking place with the launch of the Obamacare exchange through the healthcare.gov. Since October 1st, this website has been plagued with delays, errors, and fundamental flaws in the website design. This prompted USA Today to call it an inexcusable mess and nightmare. In addition to the technological failure, the website leaves Americans open to exposure of privacy information. Buried in the source code of healthcare.gov, a paragraph reads, "You have no reasonable expectation of privacy regarding any data stored on this information system. At any time, the government may monitor, intercept, search, and seize any data stored on this information system. Any data stored on this information system may be disclosed or used for any lawful government purpose." Consumer Reports states, "It's not worth the hassle, at least not for now. Stay away from healthcare.gov for at least another month if you can." This is not reassuring for Americans entering personal, medical, and financial information onto the government website, especially when Congress is still reviewing the IRS for gross mismanagement and collecting private individual information. John McAfee, founder of McAfee Antivirus, emphasized last Wednesday millions of Americans could have their identities stolen as a result of signing up for Obamacare. Despite this major malfunction and structural defect, the administration still has penalties in place for individuals that don't obtain coverage. Mr. Speaker, this is not acceptable. Prior to October 1st, my colleagues and I emphasized the inability of the Department of Health and Human Services to implement these exchanges. Therefore, if an individual does not wish to subject themselves to the risk of identity theft, they should be allowed to make that decision without the consequence of fines forced by the federal government. That is why I'm working on legislation right now to ensure that Americans are not being punished for failing to buy a health care plan from a dysfunctional system. Additionally, Mr. Speaker, the Associated Press reported that to date, only 476,000 people have enrolled. Mind you, that's 476,000 Americans that are left open to identity theft. I'd like to point out that this is about the 36 states enrolled in the federal facilitated marketplace. 36 states. At one point, healthcare.gov posted error messages in at least 24 of those 36 states. Further, according to USAspending.gov, over $600 million of taxpayer dollars have been spent setting up these failed exchanges. Mr. Speaker, this is an insult to the American taxpayers. CGI Group, one of the main contractors for healthcare.gov, reported that the site's design was changed about a month before its debut to prevent users from comparing prices without registering for their account. Why would the administration agree to remove the price comparison option when the president has promised the country affordable health care? It's because for some, healthcare rates may become simply unaffordable. The administration announced that they would provide a new shop and browse feature to the website. However, Mr. Speaker, this new feature is not giving consumers the real price. In some cases, people could end up by paying double what they see on the website. For example, CBS News ran the numbers for a 48-year-old woman in Charlotte, North Carolina, who is ineligible for subsidies. According to healthcare.gov, she would pay $231 a month, but the actual plan on the Blue Cross and Blue Shield North Carolina website costs $360 a month. This is more than 50% increase. The difference, Blue Cross and Blue Shield requests the birth date before providing more accurate estimates. further providing the point that monopolies are problematic as well, especially in North Carolina. Hundreds of millions of taxpayer dollars are being spent on a system that does not work. Therefore, there is one question we must all ask ourselves. Is the Affordable Care Act really affordable? Mr. Speaker, with that, I yield back the remainder of my time.
The gentlewoman yields back. The chair recognizes